about pediatric disorders part 2. Today we're going to talk about spinal bifida. If you know spinal bifida, let's summarize spinal bifida, what it is in a nutshell. Spinal bifida is the malformation of the vertebra and the spinal cord. A birth defect that affects the child that prevents the spine and the spinal cord to properly close. And this malformation and defect happens during the early stages of pregnancy, especially during the first month. What can cause spinal bifida? Number one is insufficient folic acid. When a woman is pregnant and she's not taking enough folic acid, this can cause it. Number two is diabetes when the woman is pregnant. Number three is use of drugs. When the woman is pregnant and she is abusing drugs, taking street drugs, yes, it can cause spinal bifida. What happens with the spinal bifida? So when a child is having spinal bifida, it means that the spinal cord, right? During the child's formation, the spinal cord is not properly formed. So the end of the spinal cord or somewhere around the spinal cord, it was not properly closed. So when the spinal cord behind the back is not properly closed, there is an opening. What can be happening? This will cause some nerve damage, and this nerve damage, depending on the severity of the spinal bifida, it can cause the child to have some learning deficits. It can cause the child to have hydrocephalus, meaning excess fluid in the brain. It can cause the child to have weakness and paralysis also. Now let's talk about the three most common types of this disease process that you might likely see on your exam. Number one is the occulta. The occulta is the type that just shows up as a dimple, like as a dimple around the spine where it has that opening that it wasn't properly closed. It's just going to be like a dimple. Can be noticed during early childhood, even during adulthood. This one does not come with any kind of disabilities at all. Rarely seen with disability. The second severe one is the meningocele. The meningocele one just have meninges fluid in it. This meninges fluid is just simply spinal cord fluid. It's not supposed to be coming out from the spinal cord, right? So that's fluid that should remain in the spinal cord. But because there is a space between the spine did not properly close, so there is a sac, protruding sac that is containing that spinal cord fluid, which is the meninges fluid, around where it did not close, around where the spinal cord did not close. So let's say this is the spinal cord and this is where it did not close. So around here is going to be like a bulging, protruding sac that is containing that fluid, okay? The worst and the most severe type of spinal bifida is the myelomeningocele. The myelomeningocele type of spinal bifida causes severe damage. Now, this is going to cause the child to have a severe or a larger protruding sac that is filled with the damaged nerves. It has the damaged nerves, and it also have a protruding spinal cord protruding through the sac, and it also have the meninges or cerebrospinal fluid protruding out. So this type is the worst, is severe, because with this type, the child is really almost, in most cases, the child will be needing a lifelong care, because the child could be paralyzed and the child could be weak. And this type is really the type that you really need to pay much attention to the child. And in most cases, this is the type that you will see on your exams for you nursing students. With this type also, you're going to see the child could have hydrocephalus, meaning excess fluid in the brain also. So this is the worst of spinal bifida, myelomeningocele. You can pronounce it however you want it, okay? But just know what I'm talking about. And now, how can we care for this child with this condition? With protruding sac behind their back, around their spine, we can now lay that child flat. You guys, you might see this on your exam. Remember, the best position for a child with spinal bifida, especially if it's the meningocele one or the myelomeningocele one, the best position is to put them on prone position, okay? And now, how can we solve this problem? How can we solve this problem generally? How can we treat? Now, this process can be treated with surgery, especially when the child is is just being born, they can take the child back to correct that spinal cord defect that is not properly closed. They can try to close it back. After surgery, post-op, you're going to make sure that you lay this child. I say it again. Prone position, prone position. When you see it on your exam, lay the child on prone position. Okay? Lay the child on prone position. And you're going to be assessing that child for any neurological changes. Because remember, this is spine problem. This is neurological problem. So they could have some neurological changes that you might want to catch on time. And also, we need to give this child some fluids. That you will lay that child on what? On what? Prone position. Prone position. You think about this. When somebody have a protruding, something protruding that is filled with sac of fluid, girl, what are you going to do? Are you going to lay that person flat? No. Please put that person prone position. Prone is like this. When you put them prone position, you are relieving pressure. You're relieving pressure of that back where they have the protruding sac, filled with sac and damaged nerves. Okay? Good luck on your exams, and let me know if you like this so we can do more.